Today, our topic is upper limb. This will be the second part of the upper limb. In the first part, we have done about arm, the anterior and posterior compartment of the arm. In this part, we'll study about this is the second part, and it is consist of anterior and posterior compartment of forearm. Okay, so first of all, we'll do anterior compartment. In anterior compartment, we have three layers of muscles. Okay, first will be superficial layer. In the second layer, we will have the intermediate layer, or we can say middle layer. And in the third layer, it is deep layer. Okay, so let's do one by one. First of all, if you look at our hand, we will see the superficial layer. In the superficial layer, we have some muscles. Let's learn it. Okay, so the first muscle in our hand, in this will be the superficial, this one. So let's see how our superficial hand muscles look like in our hand. First of all, the muscles in our hand is, okay, I will not do okay, brachioradialis muscle. This is the lateral most muscles of our hand. This is this one. Okay, brachioradialis. Brachio means from arm, and radialis, which will attach to the radial. Okay, radial side. Our thumb is attached to the radial side of the hand, that is radius bone. Okay, so it is how it is named, brachio, arm, radialis to the radialis muscles in the distal part. Okay, so this is the brachioradialis. But there is one thing, that this muscle is not from the anterior compartment. This is the posterior compartment muscle, because it is innervated by radial nerve. Anything which is innervated by radial nerve, it is of posterior compartment. Okay, so this muscle is not from anterior compartment, but it is located laterally and little bit anterior. If we touch our hand, our forearm, the most lateral muscle which we can feel from the above, this muscle is brachioradialis muscle. Okay, now second muscles. All of the muscles which are present in the superficial part or anterior compartment are flexors muscle. Okay, so here first is flexor carpi ulnaris muscle. Flexor carpi ulnaris. Let's see, flexor means to the anterior compartment, carpi from the carpal. It is attached to the carpal. Okay, and ulnaris bone. Okay, so let's see the flexor carpi ulnaris muscle. Let's trace it. See this one. This muscle is flexor carpi ulnaris muscle. Okay, now second muscle is our flexor carpi radialis muscle. This muscle is from flexor side or anterior compartment, and from the carpal and radial. It is attached to the radial bone. Let's see this muscle. Okay, not this one. It is coming here, and it is attached to the radial side of our arm. Okay, this is the flexor carpi radialis muscle. And the third muscle we have in the anterior compartment is, let's do it purple, pronator teres. Yes, pronator teres, it is little bit transverse muscle in our hand. This is pronator teres muscle. Okay, so these are the muscles of the superficial. Now one more muscle left. Let's do this with blue. And this muscle is little thin and long. Okay, and this is palmaris longus. Palmaris means to the palm, longus, long muscle. It is coming all the way and attaching coming to the palm side of it. That's why it is named as palmaris longus muscle. Now one more thing I have to tell you that we have over here one fossa. Okay, that is cubital fossa. How cubital fossa is formed? Let's see. If we will see, let me clean this all. Okay, if we'll see these muscles carefully. This is the pronator teres muscle. Okay, this is pronator teres muscle, and this muscle, brachioradialis muscle. Okay, these brachioradialis muscle, lateral side, and this is the medial side. And if I will make one imaginary line, okay, from where to the medial epicondyle and the lateral epicondyle, one imaginary line over here, we can see one fossa over here. This is cubital fossa. Okay, so lateral to the cubital fossa is which boundary? Yes, it is brachioradialis. And to the medial, which muscle is present? Yes, pronator teres muscle. Okay, and to the base, it is imaginary line from the medial and lateral epicondyle. Is that clear? Now let's come to our intermediate layer. In intermediate layer, it's very easy. Only one muscle is there. Which muscle is that? It's flexor digitorum superficialis. Superficialis means something is also there below this muscle. Okay, so flexor to the anterior compartment. Digitorum. What is mean by digitorum? To the digits. To digits. Its tendon will come and attach to digits. Yes, so this is the flexor digitorum superficialis. Okay, and then we have the deep muscle. In deep muscle, if this is flexor digitorum superficialis, we also have flexor digitorum profundus. Profundus means deep. It is present deep to the superficial muscle. So this is coming here, and it will all go to the distal phalanges. Okay, it will come and stop here. Okay, but it will go all to the distal phalanges of our hand. Now the second muscle is flexor pollicis longus. Flexor means to the anterior compartment, flexion muscle. Pollicis means thumb. Longus, longest muscle. It is coming here and it will attach to the thumb. Okay, this is the flexor pollicis longus. One more muscle we have here, supinator muscle, which help to in the function of supination of the arm. And one more muscle, pronator quadratus. Pronator, which will help in pronation, and it is a square or rectangle muscle. That's why it is pronator quadratus muscle. So these are the muscles in our hand: superficial, intermediate, and deep. Let's make a diagram which will be easy to learn for us. So in anterior compartment, we have one layer, superficial layer, and middle layer or intermediate layer, and the deep layer. Okay, so here we have pronator teres, we have flexor carpi ulnaris, flexor carpi radialis, palmaris longus. Okay, in intermediate muscle, we have only one muscle, that is, yes, flexor digitorum superficialis. which will supply to the our digits. Okay, superficialis. Now deep muscle we have flexor. This is superficial. We will have deep here. Flexor digitorum profundus. Flexor, this will go to digits. Again, next one will be going to the pollicis. Long, yes. Pollicis means thumb. Pollicis longus. And pronator quadratus. Okay, but I didn't mention one muscle over here. It's about brachioradialis. Why? Because I said your brachioradialis muscle is present anterolateral of the arm, but it is supplied by radial nerve. Okay, it is supplied by radial nerve. Any of the muscle which is getting innervated by radial nerve, it's about the posterior compartment. Okay, so in posterior compartment, we have the superficial muscles are. In superficial muscles, we will see these muscles. In the superficial muscle, we have the extensor carpi ulnaris. All extensor will be here. Okay, so extensor carpi ulnaris, extensor carpi here will be radialis longus, extensor carpi radialis brevis. Okay, we have extensor digitorum for our digits and extensor digiti minimi for the short finger, little finger. Okay, and we also have some muscles. Abductor pollicis longus, extensor pollicis brevis, and extensor pollicis longus. These are the deep muscles. We'll do first the superficial muscle. Okay, so the superficial muscle, let's do it one by one. In extensor carpi ulnaris, it will be the ulnar bone. Okay, ulnar side of the our hand. So it's coming all over here, and it's will attach to the ulnar carpal and carpal side. Okay, carpal bone. And then we have extensor digitorum. Extensor digitorum means digit. It will supply to, it will bifurcate like this and it will come like this. Okay, digits. Now we have another muscle named as extensor digiti minimi. Digiti minimi means small little finger or short finger. It will come all over like this and it will innervate only and only our little finger. Then over here we have extensor carpi radialis longus and extensor carpi radialis brevis. How we will define this? This is of course the longest. It will travel all over the length of the arm and it will go to the, it is innervated to the here carpal bones, the first and second carpal bones. And then we are having the short one, that is this bone, brevis bone. It's here, it's shorter than the longest muscle. So this one is extensor carpi radialis brevis. So this all we done the superficial muscle. Let's go for deep muscles. Deep muscles. Deep muscles are, see, extensor indicis, which will, indicis means the first finger. Okay, so it will help in extension of the first finger. Okay, and then we have extensor pollicis longus. Okay, extensor pollicis longus, which will go to the pollicis means our thumb, and this is the longest muscle. That's why it's extensor pollicis longus. Another we have extensor pollicis brevis. It will be the shorter than longest muscle. That's why it's pollicis brevis. The last muscle we have abductor. Abductor means moving away from away. It will help to move away. Okay, so this is the abductor muscle. So let's change the color and it red, and it's abductor, pollicis, longus. Let's make the note over here. Superficial and deep muscle. Superficial and deep. So in superficial, all extensor we are having extensor carpi radialis longus. It will be longus. Okay. Another will be extensor carpi radialis brevis, short muscle. We have another extensor which will go to digits, digitorum. We have extensor which is to radial. We will have now extensor carpius ulnaris. We'll have to the ulnar side, and then extensor digiti minimi to the little finger. Over here in the deep muscle, we have here we have little finger. Here we have the first finger, extensor indicis. We have done the little finger. We did the all the digits. We have done the first finger. Now we also have abductor, pollicis to the thumb. Yes, longus. We have extensor, pollicis, longus, and extensor. This is the longest. This will be the shortest. So brevis. Extensor, pollicis, brevis. Okay. So until we have done the superficial and deep muscle of the arm and forearm. So what we have done right now, from the arm we completed the anterior compartment and posterior compartment. In anterior compartment what we are having? Yes, we have BBC muscles over here. In here we have triceps and anconeus muscle, which are also going to the forearm. Okay, triangular muscles. In the forearm we have done anterior compartment. In anterior compartment we have a superficial, intermediate and deep layer, and we have done posterior compartment. In posterior compartment we have superficial and deep layer, all extensor over here, okay, and all flexor over here. We have done these also. Now what is left? We have remaining hand part. In hand we have 20 muscles. Okay, we will continue these to the next video. Until that, if you have any query, do mention, do comment, and subscribe for more. Thank you for watching.